excited about the data. I know many of you attended this last year, and it's pretty eye-opening, I think, as well as I think you'll also experience, yeah, okay, that makes sense, I knew that. As we go on, I want to introduce Sarah Hughes. Sarah is the research director for Colorado Children's Campaign. She leads the organization's research efforts, including the development and publication of Kids Count. Report, she travels to the state to present community-level data on kids and provides research and data support to advance the Colorado Children's Campaign policy agenda. Prior to her work at the Colorado Children's Campaign, Sarah spent many years working directly with children and adolescents in various capacities. She holds a master's of social work with a specialization in advocacy, leadership, and social change from the University of Illinois. So Sarah, thank you very much.
Thank you
for being here. We're excited to hear your presentation.
Thanks a lot, Jen. And I have to first echo Jen's wow. This is such an awesome group, both in terms of size and then also in terms of just the diversity of the different types of organizations that you all represent. At the Children's Campaign, we work in three primary areas, which is early childhood learning and development, child health, and K-12 education. And I think we have not just one, but several representatives from each one of those areas here today. And we know you all are so busy doing the important work of working with kids and families every single day. So we really genuinely thank you for taking a couple hours out of your day to be here with us, because we're really excited to be here. I should have said that we're really excited to be back here because we came last year and did a similar presentation about the Kids Count data for Grant County. And so just out of curiosity, by a show of hands, how many people were here at last year's presentation? Okay, a few, but not too many. That's good. Some of this information might be a little bit of a review for you, but then you'll also be able to see how things have kind of changed over the last year or so. But before we dive into the data, I'll give you just a brief overview of who the Children's Campaign is and how many people are already familiar with the Children's Campaign. A few? All right, I'll give you my full spiel then for those of you who are not totally familiar. We are a nonprofit, nonpartisan research and advocacy organization that focuses on improving child well-being in Colorado, primarily through advancing public policy. So we don't do any direct service work with kids and families. We really focus on being at the Capitol, working with our elected officials to make sure that the policies that are passed here in Colorado benefit children and don't harm them in any way. And as I mentioned, we work in those three different issue areas, and one of the most important things to know about us is that we are a research-based advocacy organization. So when we're making decisions about which policies to support, which policies to oppose, we're not doing that by trying to, kind of endear ourselves to any particular political party or stick to any particular ideology. We absolutely work across both sides of the aisle to accomplish what we think is best for kids. Because even though we work on both sides, no matter what side that puts us on, we're always on the kids' side and always thinking about what is best for kids. And one of the things that helps us figure out what's best for kids is our research work, primarily our Kids Count in Colorado report. That's kind of the cornerstone of our research work at the Children's Campaign. And hopefully all of you have at least one report within arm's reach at your table. Just to kind of give you an overview of what Kids Count is, it's a report that we release every single year in the springtime, and it has a ton of data on child well-being, not only at the state level, but also at the county level. So if you flip to the back of the book, you can see that Grant County has its very own page, where you can compare how children are doing here and how children are doing across the state on, I believe we're up to 41 different indicators of child well-being now. So probably more data than you could ever want to look at in a lifetime, unless you're a big data geek like I am. But if you need that data to write grants, advocate with your elected officials, to write a letter to the editor about issues that are impacting kids and families that you work with, it's there for you, and we hope it's useful. And so our goal today is to kind of go through some of that community level data and spark a conversation about what can be done at the state level and then also here locally. And I should mention too that we'd love for this to be as informal as possible. I know a PowerPoint presentation and a podium don't really scream informal, but please feel free to jump in at any point if you have input, because we might have tons of data and numbers, but you all are the true experts about what's going on with kids in your community. You see them every day, you work with them every day, you see a lot of these issues playing out. And so if you have any input about how you see these issues popping up in your work or any questions, don't be shy about jumping in. And can everybody hear general trends happening in Colorado's child population, and then the trends that are happening right here in Grand County. So the first thing to know about our state's child population is that it's growing, and it's growing much faster than many other states around the country. And if we look at the growth of the child population between 2000 and 2012, we see that over that time period, the number of kids in our state grew by about 11%, which probably doesn't sound all that remarkable. 11% is not a huge number, but when you compare that to other states across the country, that makes us the 8th fastest growing state in terms of the number of children. And that's a good thing, because to have a robust workforce coming up in the next generation, it's really important to have a large child population, particularly since we have so many baby boomers who are going to be leaving the workforce over the next 10 or 20 years. But it's really only an asset if we make sure that every single one of those children is equipped with the skills that they need to go on and be successful, be able to be a part of the workforce, and support themselves and their families in the future and give back to their communities. And this growth that we've seen across the state, it hasn't really been equally distributed. We've seen a lot of growth along the Front Range. We've seen a lot of growth in some of our rural resort type communities. But there are a lot of rural communities across the state, primarily on the eastern plains, that are experiencing some pretty big declines in their child population. There are some communities that we visited a couple weeks ago where they've lost half of their child population over the last decade alone. And they were talking about the challenges that that presents in terms of economic development, in terms of being able to have the types of services that families seek out and attract people to the community. So that's definitely a struggle that a lot of Colorado communities are facing, and something that's going to be really important to keep an eye on in the future. Grand County is kind of right in between those two extremes that I talked about. It hasn't seen huge population growth or decline. And if we look at how the child population has changed here in this county over those 12 years, it was a very small increase. It was 6 more children in 2012 than it was back in 2000. So it stayed pretty flat, but thankfully not experiencing the kind of population decline that many other places around the state have seen over the last decade. So the growth hasn't been distributed equally geographically. It also hasn't been distributed equally when we talk about race and ethnicity and the racial and ethnic breakdown of our children in the state. Colorado is getting more and more diverse every year. And this is something that is not unique to our state by any means, but it's happening a lot faster here than it is in many other states around the country. And so we can take a look at how things have changed between the 2000 census and the 2010 census in terms of the racial and ethnic makeup of Colorado kids. So this is the racial and ethnic breakdown back in 2000. You can see that non-Hispanic white children, made up the largest portion of the child population by far. It was about 2/3 of kids back in 2000. About 1/4 of children were Hispanic, and then we had pretty small proportions of American Indian, Asian, Black children, and children of 2 or more races. So kind of keep this picture in your head, because we're going to do some time traveling forward to 2010 on the next slide and see how things have changed. And when we do that, you can see that this portion of the pie, the one that represents kids of color, got significantly bigger in a pretty short period of time, just 10 years. In the grand scheme of things, that's not very long. And particularly that growth was happening among the Hispanic population. And this is a trend that's forecast to continue. As we look at population projections, we see that in fewer than 10 years, so actually by 2021, kids of color will be the majority in our state for the very first time. And this is a really important trend, because today when we look at child outcomes, we see that across the board, kids of color are more likely to face barriers to success than their non-Hispanic white peers. They're more likely to grow up living in poverty. They're less likely to have access to early childhood education programs, less likely to have health insurance, less likely to be reading on time by 4th grade. So at every stage, they have these barriers to reaching their full potential. So by 2021, kids of color will be the majority of the child population. Not too long after that, they'll be the majority of the workforce. And if we as a state have a workforce that was never able to reach its full potential, that doesn't bode very well, not only for those children, but also for our entire state, for our economy and for our future. And so it's really important moving forward to look at how we can support all children, definitely, but particularly how do we reach those who are most vulnerable, and many times are kids of color, and how do we make sure that they have the exact same opportunities as any other child in the state. And even though Grand County is less diverse than the state as a whole, you can see that this trend is kind of playing out here as well. Back in 2000, about 91% of the children here were non-Hispanic white. By 2010, that had declined to 84%. And again, you can see the growth in the Hispanic child population here. So any questions on kind of the basics about kids in Colorado? Okay, we'll keep on moving. In the next section we'll talk about is family economic security. And this is something that we cover every single year in KidsCount. And if you were here last year, you probably already know our big headline in this section. But the big story in this area in recent years has been that the number of kids living in poverty in Colorado has more than doubled since 2000. Back in 2000, across the state, we had about 104,000 kiddos living in poverty. By 2012, that number was up to 224,000 kids, a very dramatic increase. If we look at that in terms of the child poverty rate, or the percent of kids living in poverty, you can see that back in 2000, about 10% of Colorado kids lived in poverty. By 2012, that was up to 18%. So that's about 1 in 6 children right now who are living in poverty, living in a family that most likely is really struggling to be able to make ends meet and meet all of their children's most basic needs. And now if we look at the trend and how things have changed from year to year, of course during 2007 to 2009, Colorado, along with the rest of the country, experienced a Great Recession. And so it's not surprising that during those years we saw the number of kids in poverty and the percent of kids in poverty here in our state going up. But what's pretty remarkable and pretty discouraging is the fact that in 2012, the recession had officially been over for 3 years. But we still had a greater percentage of children and a higher number of children living in poverty in 2012 than we did at any point during the recession. So we hear a lot about how Colorado is bouncing back, how we're doing better than most other states when it comes to job growth. But the truth is, when we look at these numbers, they show that there are still hundreds of thousands of families and kids that are getting left behind and are not feeling the effects of that recovery and are going to still need support from many of the programs and services that you all work with. And it's interesting too when you look at this, you see, okay, we've grown a lot over the last decade, but we're still below the national average, and that's true. They were at about 23% of kids living in poverty. We were at 18%. But if we look at how fast poverty has grown in Colorado among kids and compare that to other states, we see that over this time period, we were the 3rd fastest growing state in terms of the number of kids in poverty. If you remember back to one of the first slides, you saw that our overall child population grew by about 11%. Over that same time period, the number of kids in poverty grew by 115%, higher than faster than almost anywhere else in the country. So we're really headed in the wrong direction, and we're headed there very quickly. And poverty is, of course, something that touches every single aspect of a child's life. Kids in poverty are kind of more likely to be behind at every stage of their life than their peers. And so the fact that we're seeing more and more children experiencing this is really troubling, again, not only for them, but also for our state as a whole and for our future. Now, in addition to breaking down child poverty by state, we also break it down to the county level, because we know that Colorado is a very, very diverse state, and child poverty looks very different depending on which community you're in. So this is a map that showed the child poverty rate in 2012 by county. The darker areas are places where the child poverty rate was higher, and the lighter areas are places where it was lower. Historically in Colorado, the San Luis Valley has had the highest poverty rate in the state, as you can see here with the dark purple. But almost everywhere here has experienced a really big increase over that time period that we talked about previously. And here in Grand County in 2012, about 15% of all kids lived in poverty. So below the statewide average, but we'll take a look in the next slide at how that's changed, particularly since the recession. And when we do that, when we look at the change in child poverty here in Grand County since 2007, we see a pretty remarkable increase there. Back in 2007, so just 5 years prior to the latest data that we have, only about 10% of Grand County kids were living in poverty. By 2012, that's up to 15%. So that's about 150 additional children living in poverty in 2012 over the number in 2007. You see something kind of interesting. A lot of the time poverty is stigmatized as an issue that just affects single parents or just affects single moms. But we know that's definitely not true. And if we look at the number of kids in poverty here in Grand County, we see that about 2/3 of them actually live in married couple families. And then about a quarter are in single mother families and only 6% in single father families. That's because there's not many children living in single father families here in the county in the first place. But even though the majority of kids living in poverty are part of married couple families, kids in single parent families are still more likely to live in poverty. So if we look at the poverty rate for kids in Grand County and break that down by family type, we see that the rate for married couple families is only about 9%, whereas for single mother families it's at 23%. So 1 in 4 children essentially living in a single mother family in the county is living in poverty. But again, important not to discount those kids in married couple families, since we saw there is still a really large number of kids in those families that are struggling as well.
I have a question, and I apologize if I missed it. Would you define poverty? And did that definition carry through on, your years?
So you actually just gave a perfect segue. Okay. I promise I did not plant that question in the audience. So poverty is a word that gets talked about a lot. It gets talked about in political races. It gets talked about in all of the fields that we all work in. But it's really important to talk about what we mean by poverty, because that income level that's associated with poverty is much lower than your average person out on the street would ever get. And so just to give you a background about how the federal poverty level came to be, that's what we use to measure poverty. We use the federal poverty level, which is pretty standard. That's what most people use across the country. But the federal poverty level is updated every year based on inflation, but they haven't updated the way that it's calculated in more than 50 years. So if you can think about all the things that have changed in our communities, in our society in 50 years, it's pretty remarkable that the way that we measure one of our biggest social problems has not been updated to reflect those changes. And back in the early 1960s, when this measure was first developed, they took the cost of something that was called a thrifty meal plan. So basically a really lean amount of food that you could use to feed a family in a budget-conscious manner. And they took the cost of that food plan and they multiplied it by 3. Because back in the early 1960s, your average American family spent about 1/3 of their income on food. So back in the early 1960s, it made great sense. Now, however, in 2014, your average American family spends only about 1/7 or 1/8 of their income on food. We spend much more on things like childcare costs, healthcare costs, transportation to get to work. And none of those things were even considered when this measure was developed, but we haven't updated the way that we're calculating poverty to reflect those changes. So as a result, most people agree that the number that we're using as the cutoff for poverty is far too low to be realistic. And so just curious if anyone out there, before I give you the answer, does anyone have any guesses as to what the federal poverty level was in 2012 for a family of 4? I heard some muttering. Do you want to say it a little louder? 25,000? Good guess. How many people think it was higher than 25,000? How many people think it was lower than 25,000? How many people think it should be higher than 25,000? All of us, right? That is very close, because in 2012, the federal poverty level for a family of 4, remember not for an individual, for a family of 4 was $23,500. Now, if you can imagine trying to support a family of 4, trying to pay for childcare, trying to pay the mortgage or the rent on this amount of money, that is going to be very, very difficult, if not extremely impossible, particularly in a community like Grand County, where the cost of living is much higher than it is in other places. And so when we talk about those 15% of kids in Grand County that are living in poverty, that is an underestimate of the number of kids that are living in families that are struggling, because we're using this as the cutoff. So if there's a child in Grand County living in a family of 4 that's making $24,000 a year before taxes, they're not included in that 15%. So there has been some, I'm hearing a lot of sighs and groans. I agree, they need to come up with a better way to reflect what it takes a family to get by. And there are some efforts to do that. And one of those is called the Colorado Self-Sufficiency Standard. Is anyone familiar with that already? It's a couple people. It's not very commonly used, but I think it's a really good way and a more accurate way to look at what it takes a family to be able to make ends meet. So it's something that's put together by the Colorado Center on Law and Policy, and it does take into account those things like child care costs and health care costs. And in addition, it varies based on the cost of living. We know that living in Grand County is much more expensive than living in some communities out on the Eastern Plains. And so ideally, the self-sufficiency standard, or whatever we're usually using to measure whether a family is economically secure or not, should reflect those differences in the cost of living. And so this does. So I thought it would be interesting to take a look at the federal poverty level, which we now all know is $23,550 a year, and how that compares to the self-sufficiency standard for Grand County. And this is a Grand County family with 2 parents, an infant, and a preschooler who are both in childcare. So the federal poverty level, $23,500. Then if we look at the self-sufficiency standard, this family in Grand County would be spending $9,000 a year on housing, probably also an underestimate, but at least closer than what we have with the federal poverty level. They'd be spending almost $19,000 a year for 2 kids in center-based childcare, several $1,000s a year on food, transportation, and you can see with just childcare and housing, you're already above the federal poverty level before even accounting for any of these other things. Then we have those miscellaneous expenses that come up, and then taxes, which are not accounted for in the federal poverty level either. By the time we add all of this up, that adds up to $61,668 a year. That is definitely a more realistic estimate, and when we compare that to the federal poverty level, it's almost 2.5 times as high as that cutoff that we're using for poverty. So we can also look at the percent of kids that are living under a more reasonable income level. Unfortunately, we can't look at it for this exact self-sufficiency standard because the Census Bureau, which is where we get our poverty data, doesn't break things out that way. But we can look at the percent of kids here in Grand County that are living below 200% of the federal poverty level. And these are kids that are considered to be in low-income families. Their parents are making $47,000 a year. And if we look at that, we see among all kids under 18 in Grand County, 37% were living under 200% of the federal poverty level, much higher than that 15%. If we look at that for school-age children, it's about 1/3 of all kids. And then for kids under 6, almost half of them were living in low-income families in Grand County, and this is between 2008 and 2012. So if we compare that to the size of this group, how would you like if we drew a line down here? If we were all kids under 6, this is how many would be living in poverty, or living in low-income families. So this is not a challenge that's affecting a small number of people. It's affecting a very large number of people in child care centers and schools, people who are visiting healthcare providers. It's a huge issue. And we'll talk next about this number in particular and why it's so troubling. Why it's so troubling that so many of our youngest kids are living in poverty. But before we move on to that, does anyone have any questions about the poverty data? I'm seeing some weary looking faces. I promise you that we do have some good news in this presentation, so bear with me. We bring you down, but we'll bring you back up in a minute. All right, well, we'll move on and talk about early childhood learning and development. And I mentioned that we'll tie in that number of low-income kids, or excuse me, kids living in low-income families. But first we can talk a little bit about why those early years are so important. And I've been thinking lately that I should probably start with this section of the presentation because the truth is, everything that happens in a person's life later on, so much of that has to do with what their early childhood experience was like. You know, there's all this research coming out now that shows that obesity, heart disease, diabetes, things like that can be traced back to what a person's early childhood was like. Were they able to build a strong foundation, or was their foundation a little bit weaker? And what we know from the research is that that foundation starts being built from day one, from the day a child is born. And really, you could argue it starts being built even when the child is in the womb, in the prenatal period. But if you look at from the moment people are born, what's happening in their brains, we see something pretty remarkable. So this is brain connections in the time between birth and 14 years old. And if you look at birth, you can already see these connections forming. And these connections are going to serve as the foundation for all the skills that are going to come later in a child's life. So these are the connections at birth. If we look forward to 6 years, look at how much brain development has happened during that time period. All of these connections are helping children build skills that they're going to use throughout their lives. Then by the time a child is 14, their brain has started to prune back on those connections. And that's a normal process. Our brains kind of prioritize the connections for the skills that we use the most, and they cut back on those ones that we don't use a lot. And I heard someone say something really great a couple weeks ago in talking about early childhood brain development, and she said, thank goodness our brains do this pruning, because otherwise we would all be like 2-year-olds running around children in Colorado are not living in those environments. Far too many kids in our state are dealing with things like abuse or neglect or domestic violence in the home. And all of these things contribute to a really high stress level for kids. And if you think about what happens when you're stressed, maybe you're up in front of a room of people giving a presentation. But what happens when you're stressed is your heart rate starts to go up, your stress response system starts, your adrenaline is rushing. And then ideally, when that stressor goes away, your stress response system goes back to normal. However, you can imagine being a 3-year-old child who's being abused or seeing a parent be abused, or their parent is not able to be involved in their life because of a substance abuse problem or a mental illness. Their stress response systems are at a high level almost all the time. They can never go back to normal because that stressor is always there, or the threat of the stressor is always there. And so what happens is that their little developing brains are getting flooded with these stress hormones that are actually damaging those connections that we saw in the previous slide at exactly the time when kids are supposed to be developing so many new connections. So we can take a look at what that looks like on a brain scan. And it's interesting, for those of you who work with kids and families, you know that when you work with a child who's experienced some of those issues that I talked about previously, you can see the results of that in their behavior and their ability to learn a lot of the time. But if you did a brain scan of a child who experienced toxic stress and a child who was in a healthy environment, you could see the difference even on that brain scan, even on a biological level. So if we look at a brain scan for a normal child, this is what we see here. And you can see all of the connections kind of shooting off, helping children develop skills. If we look at a brain scan of a child who experienced toxic stress, we see far fewer connections there. And the connections are more damaged and broken because of those stress hormones that are flooding a child's developing brain. So it just speaks to the importance of, particularly during those early years, making sure kids are in a really nurturing environment where they have a positive relationship with a caregiver so that they can develop these skills during that crucial time. And there's also been studies that have looked at those risk factors that I mentioned, things like substance abuse or neglect or parental mental illness, domestic violence. They looked at those risk factors and then they looked at a child's chances of experiencing a developmental delay based on the number of risk factors in their life. And what they found is that these risk factors really have a cumulative effect. They kind of pile on top of one another. So for children who have 1 or 2 of these risk factors in their lives, they have a relatively small chance of having a developmental delay, about 5% or so. But then you see that get higher and higher and higher and higher as the number of risk factors goes up. So much so that for kids who have 6 or 7 of these risk factors in their lives, they have a 90 to 100% chance of having some sort of a delay in their development. Those are extremely difficult odds for kids to overcome. You know, we hear a lot of the time, just pull yourself up by your bootstraps, kids. You can overcome this with hard work. But these are really difficult odds to overcome no matter how hard you work, no matter how resilient you are, if you don't have a little bit of support, whether it's from your family or from an outside source. We can also take a look at some of those risk factors for toxic stress and how those are playing out here in Greene County and then across the state. So the first one I mentioned was child abuse and neglect, very harmful for a child's development. And this is a graph that shows confirmed cases of child abuse and neglect in Greene County and in Colorado. And I don't want to scare anyone. These are rates per 1,000 children. They aren't percentages. But in Greene County in 2012, you can see that about 9 out of every 1,000 children were confirmed victims of abuse and neglect. When we look at that in terms of the real number of children, that's 27 kiddos that were confirmed to have experienced that here in Greene County. Now we know that a lot of the time child abuse and neglect are underreported, so in reality that number is probably much higher. But these are all children that are at risk for that toxic stress, for those delays that we talked about earlier. We can also look at extreme poverty and kids under 6 in extreme poverty. And I don't want to make it sound like people in poverty are more likely to abuse substances and more likely to abuse their children. That's not the case. We do know that living in poverty, and particularly extreme poverty, which is only about $11,000 a year for a family of 4, can be very stressful. It's very stressful on the parents as they try to make ends meet, and oftentimes that stress gets felt by the children as well. And so poverty is also a really big risk factor for toxic stress and for some of these developmental delays. And this reflects the number of kids under 6 living in extreme poverty in 2000 and then 2010. And you can see more than doubled over that time period. So a very rapid increase in our most vulnerable population, the poorest of the poor as well. And we all talk about, a lot of the time you hear about those achievement gaps that happen in the K-12 system, or that you see in the K-12 system. But anyone who's worked in the K-12 system knows that those achievement gaps don't just start in 3rd grade when kids start taking the standardized tests that we take here in Colorado. Those achievement gaps are present from the day a child walks in the door to kindergarten, and oftentimes even earlier than that. There's actually been research that has shown that by the time kids reach age 2, kids from low-income families are already 6 months behind in their language development. By the time they're at age 3, kids from higher-income families already have a vocabulary that is twice as large as kids from the poorest families. So this really speaks to the importance of making sure that, again, all children, but particularly these most vulnerable children who need the most support, have access to really strong early childhood experiences, whether that's preschool or whether that's at home with a family, that can help prevent these achievement gaps before they start. Because the truth is, once the train has left the station, once these achievement gaps have already begun, it's really hard to close them in the K-12 education system. And so addressing this early is really the most cost-effective and the easiest way to get at these achievement gaps. And there's actually been studies that have shown that for every dollar invested in high-quality preschool, that dollar will pay back $7 in the future in terms of savings on things like reduced need for restoration, reduced need for remediation, or for a child to repeat a grade in school. So every dollar that goes into these preschool programs pays off incredibly large dividends. But we know that preschool capacity in Colorado is not large enough to serve all kids who could benefit from it. If we look at all 3- and 4-year-olds across the state, we see that fewer than half, just under half, were enrolled in any type of preschool. This doesn't even only cover high-quality preschools. And then when we look at lower-income kids, it's just above a third of those low-income 3- and 4-year-olds that are enrolled in a preschool program. So the kids that need the support the most, could benefit from the support the most, are the least likely to get it right now in Colorado. And we have some really great programs that provide preschool for low-income kids. We have things like the Colorado Preschool Program, Head Start, but these are programs that depend on public funding. And public funding is not sufficient enough to be able to serve all kids that could benefit from the program. So as a result, we see a really big gap between the number of kids who qualify and the number of kids who actually end up getting services through these programs. So this is preschool enrollment broken down by income. We can also look at it for kids of color in Colorado. So I mentioned those disparities at the beginning. And we see something similar here. We see only about 40% of Colorado's Hispanic or Latino children enrolled in a preschool program, compared to about 54% of non-Hispanic kids. Any questions on the early childhood subject?
If you address the politician, Democrat or Republican, and you asked them, or you told them that for every dollar invested in preschool saves $7 a month, what would they say are the reasons why only 23% of Colorado children have preschool?
Well, I think politicians are humans, and I think it's
That's
believe it or not. I think we as humans have a tendency to think in the short term, even if something is going to be better for us in the long term. And so our state lawmakers in Colorado, for example, have to pass a budget that's balanced every single year. And so trying to lay out a large amount of money for these early childhood programs, even if that's going to come back and pay them back in dividends in the future, they don't always look out that far. They're more concerned about looking at what does the budget look like now, how do we make ends meet now. And so I think there's a certain amount of short-sightedness that goes into funding these programs. And to be totally honest, we also have a lot of politicians and a lot of people in Colorado that believe that there is no need for early childhood programs, that kids should just always be at home being educated by parents. There are lots of families where both parents are working, or there's a single parent and they're not able to be at home with their young child. But I think there's some kind of philosophical objections and then also some budgetary ideas that have prevented us from getting to 100% of the kids that we get. Did you have a guess as to what they would say, or?
I can't. I just moved to Colorado 5 weeks ago.
Throwing into the fire right away. Well, that's kind of a quick primer about some of the things that you might hear talking for early childhood. I don't want to make it sound like there's not good work being done in the Capitol, but there are barriers to overcome.
So I actually was at a superintendent's roundtable with Congressman Polis on Friday, and then had lunch with House Representative Casey Becker. I'm not really sure why she's not here, because she's in the county today meeting with people. You know, it just depends on what their focus is. Congressman Polis is on the Education Committee federally. Casey's not on the Education Committee, the House, but they have projects and things. Transportation, I guess, in Colorado is going to be a big focus for the legislative session this year. I know the superintendents around the state, 178 of us, rallied together last year and sent legislators letters, and we were able to get some money back from the negative factor. We're doing that again this year. I think we just need to continue to educate and show that early childhood really does matter. I mean, they passed the READ Act, so as politicians, they're expecting all of us in schools to have every Colorado child reading by 3rd grade. Need a little bit of funding to help support when that 1st grade, kindergarten classroom teacher, at least here, we have the fortune of having small class size, but that's not everywhere. So they passed the legislation. We all know that reading by 3rd grade is super important. Now we need some funding for those highly trained people to come in and help those kids who are behind. So the conversations have started. We just need to continue to push from all sides.
Yeah, I could not agree. And something that affects not only people in the education realm, but health too, because the health outcomes might be farther down the road, but there are definite differences in health status based on what your early childhood is like. Yes.
Well, I think there's also a bit of a catch-22 in that we're having to pay for services for all these adults who didn't have that early childhood development, so we're paying for them now, but it's preventing us from giving the money to kids so that we won't have to pay for it.
That's very true. It's one of those competing priorities. You can't just let one generation totally go by the wayside. It's fun. I thought you had another hand up. Do you want to ask a question or a comment? Okay. Well, I promised you good news, and I promise there is good news in the child health section. So you've made it this far. We'll get some happy news in here for you in this area. So one of the areas of health that we track in Kids Count is health coverage. We know that it's very difficult to be healthy without adequate health coverage. And this is one of the state of Colorado's biggest success stories over the last decade or so. And this is a graph that shows the percent of uninsured kids here in Colorado, that's that top yellowish greenish line, versus in the United States as a whole. And you can see back in the mid-2000s, about 10 years ago, we were pretty significantly higher than the national average when it came to our uninsured rate for kids. So recognizing this, advocacy groups, some of those politicians came together and came up with some state-level policy solutions to address this problem. So we saw an expansion of something called the Child Health Plan Plus, or CHIP Plus, which serves low to middle income families. That resulted in a drop in the number of uninsured kids. We saw some efforts to make programs like Medicaid or CHIP Plus less burdensome for families to enroll in, and I think that paid off as well. And we saw some really great efforts at the community level to get eligible kids enrolled in those programs. And all of these things kind of paid off over the next several years, because you can see this big drop that happened in the percent of uninsured kids in Colorado. So that by 2011, our uninsured rate was down to 8%. And we just got more recent data for 2013, and I believe it's also at 8%. There was a small kind of couple tenths of a percentage point decline. And a lot of people ask, do any of these numbers reflect the impact of the Affordable Care Act? And they don't really yet, because there were a lot of provisions of the Affordable Care Act, the exchanges, for example, that went into effect in late 2013, early 2014. So it'll be another couple of years before we can get data to show how that law has impacted Colorado. But we know that even before that went into effect, there were some good things going on here at the state level that resulted in this big drop. And it might seem like it's kind of hard to think in terms of percentages, because that really masks the real number of kids behind those percentages. If we look at the number of kids behind these percentages, that's an additional 63,000 kids across the state of Colorado that gained health coverage, that now can go to the doctor when they're sick or go to the hospital when they're injured, and their parents don't have to worry so much about how they're going to shoulder that financially. celebrate too much. I can never let people celebrate too much because that still leaves about 100,000 kids across the state who are without health coverage. And you can see that uninsured rates by county kind of vary a lot too, just like we saw with child poverty. So the theme of this map is kind of similar. These places with the darker shadings are places where the uninsured rate was higher, and then the lighter areas are places where it was lower. Here in Graham County in 2012, kids are slightly less likely to have health coverage. In 2012, about 13% of the county's kids were uninsured, compared to that 8 or 9% that we see at the state level. And this is not uncommon for a rural resort community, because if you look and you see counties like Broward County, Eagle County, Summit County, a lot of these places have temporary, seasonal type employment that might not offer health benefits like some other year-round jobs may offer. And so as a result, we typically do see in these rural resort communities a higher percentage of kids who are uninsured. And I didn't include the trend here for Grand County, but there has been positive movement here in Grand County as well. We've seen an increase in the number of kids who have health coverage. So we talked about earlier those programs like Medicaid and CHIP Plus, and those are really beneficial programs. For those of you who don't work in the public health sphere, Medicaid covers kids and families with incomes up to 133% of the federal poverty level. That's about $29,000 a year per family of 4. CHIP Plus covers kids and families with incomes that are too high to qualify for Medicaid, but below 250% of the federal poverty level, or about $58,000 a year for a family of 4. So really critical programs for kids who might not otherwise have coverage if it weren't for these two programs. However, across the state, we know that in 2012, there were about 90,000 kids who qualified for coverage through one of these programs, but were not enrolled for one reason or another. And we hear different reasons for this. We hear that a lot of the time, kind of the most basic things, families aren't aware of the programs, and so if you're not aware, you're not going to take the initiative to go down to the public health office and apply. We also hear that families avoid the programs sometimes because of the stigma that can come along with being on public coverage for some people. In communities where there might be a larger undocumented population, you may have children who are U.S. citizens and who qualify for the programs, but the parents are kind of hesitant to engage with the government because they don't know what kind of information they're going to have to provide. So for all those reasons, and probably many, many more that I didn't touch on, we see a really large number, about 16% of all kids across the state who qualify for the programs but are not enrolled. And here in Grand County, at least in 2012, I'm sure there's been progress made since then, but the most recent data we have shows that only about 30% of kids who were eligible for Medicaid or CHIP Plus were not enrolled for one reason or another. And if I had to guess, I would say that this percentage has probably gone down over the next couple of years, because we know kind of from, or I'll back up for a second, one of the things that has kind of helped with this statewide has been the Medicaid expansion that happened as a result of the Affordable Care Act for adults. So Colorado expanded the income eligibility level for adults to be covered by Medicaid. And what started happening was that adults would come in to sign up for Medicaid, and they would find out that their children are already qualified for Medicaid or for CHIP Plus. So their children got enrolled as well. And so we've heard some preliminary data from the state's health department that tens of thousands of these previously eligible but not enrolled, the tongue twister, children have now gotten signed up for one of the programs. So I think hopefully next time we come back here, this 29% will be a lower number. And if we look at that in terms of like what percentage of uninsured kids those eligible but not enrolled kids represent, we see that of the 387 uninsured kids in Grand County in 2012, all but about 90 were actually eligible for coverage through one of those two programs. And I know I make it sound so easy, I'll just go out and enroll those kids in the programs and it'll be fine. But the truth is that's very, very difficult. Colorado has a really mobile population with people moving in and out. It's hard to locate and target the kids who don't have coverage. So it's an uphill battle, not only for Grand County, but for communities across the state as well. Jen.
I just want to make a comment that 29% of kids eligible but not enrolled. 3 years ago, I think it was 46%. So that just shows the tremendous work of public health, social services, everybody in the community, making sure people are aware of that. And then our I don't even want to say preliminary data, but my office has health coverage guides, so I keep track of the numbers of people who are enrolled Medicaid and the Affordable Care Act, the Connect for Health Colorado. And we think about half of our uninsured population from the beginning of 2014 is already covered with insurance. So hopefully, by the time we get that 2014 number in 2 years, we'll see a significant difference.
Yeah, and to tag on to that, we've seen a huge decline in demand for AIDS vouchers, which are the vouchers we provide for uninsured children to the healthcare. So, because they're covered in some other way.
It's amazing. I know there are a lot of people, probably Jen and people like you, that are anxiously awaiting. It'll be like data Christmas when we get the 2014 health insurance numbers. So we'll have a couple more years to wait, unfortunately, but hopefully we can have
I can attest from the hospital standpoint, our pay rates and everything from us significantly.
It's so interesting to hear that anecdotal stuff because it's so bad here, and so that gives me hope for the future that it will be better. Thanks, you. We looked at these already. Another area that we touch on in Kids Count is maternal and infant health, because we know that really when children are young, their health is so intricately intertwined with their mother's health in that prenatal period and then even after a child is born. And we have a ton of maternal and infant health data, birth data, on those county data pages in the back of your Kids Count report. We just wanted to pull out 2 positive trends that I've seen here in Grand County by looking at the data. The first one is a decline in the number of percent of babies being born in the county to women who reported smoking during pregnancy. And smoking during pregnancy, as most people probably know, is associated with a lot of complications like premature birth, low birth weight, things that can kind of put children behind right from the very start. So you can see here that back in 2002, about 14% of all babies born in Grand County were born to moms who reported smoking during pregnancy. By 2012, that number was down to 9%. So a lot of progress being made. The second area where there's been some progress is in the area of teen births. This is something that we've seen statewide. You can see here across the state of Colorado this really dramatic drop, primarily since 2007, 2008 or so, in the teen birth rate. And that's happened here in Grand County, although there have been some little bumps along the way. But you can see the teen birth rate in 2012 was lower than it was, almost half of what it was in 2002. And again, not to frighten anyone and think 17% of girls in Grand County had a baby. This is 17 out of 1,000. It's just kind of a ratio that lets us compare it to the state level. But lower than the statewide average and continuing to go down. So another really positive thing. Any questions on health? Okay, well I put education behind health because we know that these things are so connected as well. If you're not healthy, it's going to be really hard to succeed in school. If you don't have a high level of education attainment, you're less likely to be healthy in the future. So just something to keep in mind, even though we present these as very different sections, we know that they're all kind of intertwined and they all kind of support each other. But the first thing I wanted to look at was some of the demographic changes that have happened among the student population here in the 2 school districts in Grand County. So if you look at overall pupil enrollment in East Grand and West Grand since 2000, you see that about the pupil enrollment went down by about 10% to the overall student enrollment, overall student population. If we look at 2 of our most vulnerable groups of students, low-income kids and English language learners, let's see how that changed. So the number of kids who qualify for free reduced price lunch in Grand County School District over the same time period increased by 108%, while we saw the overall student population go down. The number of English language learners in Grand County schools increased by 269% over those 15 years or so. And these are groups of students that oftentimes need additional support, they need more resources, more time, in order to be able to be on equal footing with their peers. And all of this is happening at the same time that a lot of school districts' budgets are being cut. So there have been a lot of challenges in facing districts across the state as they try to support vulnerable populations on dwindling funds. And so when we look at kind of the differences in achievement between free and reduced price lunch, students who qualify for free and reduced price lunch in their peers, or English language learners in their peers, not surprisingly, we see some pretty wide achievement gaps. These are what the achievement gaps look like in the East Grand School District over the last 10 years or so. So on the left, we have the percentage of kids who scored bottom line is students who did qualify for free reduced price lunch for low-income kids. And you can see that every year that's reflected here, there is a very big difference in proficiency based on students' socioeconomic status. So in 2014, for example, 85% of middle to upper income kids in East Grand were reading proficiently, compared to only 63% of low income kids. Very similar achievement gaps when it comes to math. And I could put up almost any school district in the state and you would see something very, very similar. This is by no means totally unique to the East Grand School District.
So is that chart off of 2013 data or this fall's data?
This is 2013 all the way up to 2014, so it would be this spring's TCAP scores.
And you got that in August?
Yes. We can also look at that for the West Grand School District. West Grand looks a little bit different. It has kind of changed from year to year. In 2014, there was about a 1 percentage point gap there in reading, but you can see much, much wider in math. And this is important when we think about interrupting the cycle of poverty. Because if we currently only have, well, we have 3/4 of our low-income kids reading proficiently, but only 39% doing math proficiently, that doesn't bode very well for their ability to catch up and graduate from high school and either go on to college or get a career that's going to allow them to support their families in the future and bring their families over that self-sufficiency standard. So again, thinking about how do we improve student achievement for all kids, but particularly how do we boost achievement for our most vulnerable kids. And again, oftentimes, I mean always, it's not something that is totally up to the K-12 education system. It has to start in early childhood as well. So these are differences based on socioeconomic status. We can also look at differences for English language learners and then children who are proficient in English. And you can see it's a very similar picture here. We have East Grand in 2014 and West Grand, and you can see the differences in achievement between English language learners and English proficient students. So to wrap up, we'll look at graduation rates. And we've seen graduation rates kind of bounce around a little bit for the two districts here in Grand County, but in 2013, which is the most recent data that we have at least, about 8 out of 10 students in each of the districts were graduating on time, which is higher than the statewide average. Good thing. But we know that across Colorado, there are many, many students who, even though they graduate from high school, are not actually prepared once they go on to college. So we look at something called remediation rates. Remediation rates are basically looking at students who graduated from a public high school in Colorado and went on to attend a public college or university in the state, and were required to take a remedial course or kind of a review course in at least one subject. And across Colorado, about 4 out of 10 of our high school graduates fall into that bucket of kids who needed to take a kind of a high school level review course before they could move on and do college level work. Here in the East Grand School District, and West Grand didn't have a large enough student population to publish this data, but a lower percentage of kids in the East Grand School District requiring remediation once they go on to college, but still about 1 in 5 kids. So we kind of started the presentation talking about poverty, and we're ending it talking about high school graduation rates and the importance of graduating high school on time. So just to kind of tie those two things together and illustrate how it's all connected, I thought we could look at poverty rates for different families with different levels of educational attainment. This is based on the householder's educational attainment. So for families in college who lived in poverty in 2012, if that householder was able to get a high school diploma or a GED, the poverty rate gets cut significantly, down to 11% just with that high school diploma. For someone with some college or an associate's degree, about 11% of those people live in poverty, or those families live in poverty. And then if we look at families where the householder has a bachelor's degree or higher, only about 3% were living in poverty in 2012. So it just goes to illustrate the importance of making sure that all kids have the support that they need to graduate from high school and go on and get a job that's going to allow them to support their families. And they're going to need that support not only in education, but also with their health, and also in their early childhood years as well. So there's kind of a piece for all of us to work on here. So, deep breath. I know that was a ton of data in a really short period of time, and your heads are probably spinning, but I promise that we do not come here to make your head spin or to bring you down. We really put out this information and we publish Kids Count because we believe that what gets measured gets changed. And if we're going to much for being here today. I really appreciated your attention and input. I'm going to turn things over to my colleague Liz now, who's going to talk a little bit about advocacy. And just to kind of connect our two parts together, we talked about a lot of things today that are dependent on public policy. We talked about education funding, funding for early childhood programs. A lot of these decisions are made by policymakers at the state and local level. And so Liz will talk a little bit about how you can use this data and pair it with the stories of the kids and families that you're serving and use it to influence some of our elected officials. So thank you again, and I will turn things over to Liz. Thank you.
Again, my name is Liz Helston, and I coordinate the Grassroots Advocacy Network at the Colorado Children's Campaign, which is called It's About Kids. So I get to work with great people like Jen and Jess and Katie and Jean Herman, advocates throughout the state to help us put public policy into place that benefits kids and families. So I'm going to talk very briefly. I know you just had a ton of information. You're probably hungry, getting ready to go for our next group activity. But as Sarah said, we really feel at the Children's Campaign that the greatest way to affect change for kids across Colorado is through the public policy process. And we want to invite you all to engage in that process. We know that you work really hard on behalf of kids, day in and day out in your community, but we really want to provide some tools and some resources for you to engage in the public policy process in this election year. And we're going to give you some tools and tips on how to do that. So who can advocate? Basically, you can. Everybody in here is an advocate for kids, obviously. You care about kids and you wouldn't be here today. You're the expert. You know the kids and families that you serve better than anybody else. So we really invite you to bring data to life by telling the stories of children in your community. When you pair those personal stories of kids in your community who are struggling with the data, like what's in Kids Count, that is the most effective way to engage in advocacy. And we really look at advocacy as sort of a three-legged stool, three pillars that hold up effective advocacy. And that involves decision makers, so your policy makers, your county commissioners, your school board, the community as a whole, and the media. So the community leg, talk with your family and friends. Take the data book home if you could use it. Take that county sheet home. Talk with your family and friends about maybe one statistic that you heard today that's going to keep you up at night. And propose some solutions. Talk it out. And we're going to do an activity about that in just a few minutes, so you'll have some practice. Share that Kids Count data. The entire Kids Count book is available online on our website. If you can use it today, please take a copy. We don't have one for everyone here. As you can imagine, they're a little bit expensive to print. But if you need one, please take it with you and share it with others in your community. Discuss it at your book club or your church group or your PTA meeting. Keep beating the drum on these statistics and continue that education and build that awareness throughout the community for those who couldn't be here today. Host an event. Help others in your community learn more, especially again during this election season. It's really important. The media leg. Follow the Children's Campaign on Facebook and Twitter. We're really engaged in social media. Sign up for Kids Flash. When you signed in today, there was a little opportunity to check that box. Kids Flash is our electronic newsletter that comes out every Friday. It's a very concise, timely report on what's happening at the public policy level for kids and families. During the legislative session, we'll follow bills that are being tracked through the state capitol that affect kids and families. We'll put out new reports, we'll put out new research. We hear from a lot of folks who are direct service providers that it's a really good way to, on a weekly basis, stay up to date on the most current trends and data and information about kids and families. So we encourage you to sign up for that if you haven't already. Write a post on your own Facebook or tweet about kids. Write a letter to the editor of your local newspaper about your program that serves kids and families. Again, continuing that awareness, continuing that education. Now the decision maker leg. Send an action alert. We also, during the legislative session, in addition to Kids Flash, we will occasionally send out an action alert where we invite you to contact your legislator about an important vote that's coming up. Encouraging them to either vote yes on something that the Children's Campaign is trying to pass. It's going to help kids and families. And just as an example, you all have a list of legislative impacts. These are the bills that the Children's Campaign actively engaged on this past legislative session. We can't do that without the help of constituents throughout the state. So not only staying up to date on the data, but also taking part in the legislative process, sending action alerts, encouraging people to contact the legislator about bills that are coming out for vote. It's a really important part of what you do. Contact your legislator with a letter, email, or phone call. Another tool on your table is a district-specific fact sheet. So Sarah worked so hard all summer long, slicing and dicing the data for all 100 House districts and all 35 Senate districts. And all the candidates and all the current legislators received this for their district this August. So Representative Becker and Senator Baumgartner have their district-specific fact sheets, and now you do too. So they can't claim ignorance because they have to state it. If there's something in here that you would like to talk to them about before the election, or after the election, or during the legislative session, please feel free to give them a call because they have the same information that you do now. So that's another important tool that the Children's Campaign puts out each year. Attend an advocacy day. Jess did that, Vinny did that. Jen, maybe you've been to an advocacy day. If not, you can come to this one. We're hosting it again in March. Children's Campaign gathers, Wendy's been, yep. We gathered folks in Denver to meet with their legislators. We provide training. We all walk over to the Capitol together. We set up appointments with legislators so that you can actually talk as a constituent. So we do that every April. It's going to be in April this year. And we invite you to visit our website and learn more about that. Testify for a bill. Children's Campaign can facilitate that as well if you want to travel to Denver. Resources. Again, we invite you to visit our website. There are action alerts, toolkits, the data center is there, link to our Facebook and Twitter. Here's information about contacting your legislators, Representative Baumgartner, Representative Becker, and the gentleman who is running against her. This is, because Colorado has term limits, I think this is a really interesting and important consideration, that entering into the coming legislative session in January, before taking into account the outcome of close races, 64 of the 100 legislators in our General Assembly will have held their seat for less than 2 years. So these are people who need education and need data and need information. And lobbyists from transportation, from oil and gas, from agriculture, they're all knocking on their doors too. So if you feel strongly about speaking up for kids, you've got to make your voice heard in the mix of all of that. So researching how your legislator or candidate has voted or what their positions are, you can do that on votesmart.com. There are over 60 different issues. You can see what positions they've taken or what their voting record looks like. So there's a ton of information out there you can find out about how your legislators feel on different issues. I'll just close by putting up a map of our It's About Kids network. All the purple counties are currently in our network. My colleagues joke that I'm on a quest for world domination. I'm hoping to get advocates in all of the counties. Next time I come, hopefully the map will be all purple. But I want to thank Jen, Jess, Katie, and Jane, who's not here, for hosting us today and bringing such a great group here together. With that, yes, question.
Well, question, maybe a statement. I am a politician and I am a human being, so just wanted to
Appreciate that.
yeah. And you hit on a great question because I think even at the local level, we have we're a service industry. That's the way I look at government. How much service are we going to provide? If we're going to put more into education, where are you going to take it from? Or are you going to find new money? And that's where you have the hardest time with the legislators. They're looking at Tabor, they're looking at everything else. We're actually ratcheting down the amount of money. And the public perception out there is to ratchet down, spend less money. No government is good government. That seems to be a reoccurring theme. So that's the hard part. To answer your question, the hard part is what services are you going to give up because there's no new money? Or are you going to create new money? And that's a hard thing to do in this county, state, and federal level. To pass a tax increase or any type of an increase. So that's kind of the dilemma that politicians have. And everybody supports kids, everybody supports education, everybody supports early childhood education. Who's going to pay for it? Where are you going to come up with the money? And that's your toughest charge. is not just to get the legislators to do it, but to get the people to vote for it. Casey Becker is not here in the county today. I just got in touch with her. She's going to be here tomorrow.
Oh,
So you'll
tomorrow.
have a great opportunity. She'll be at Rocky Mountain Roastery, I believe at 7:30 in the morning. So you'll
7:30
have,
to 9:30, I think.
I think so. So you'll have face-to-face time with your state representative, and it'll be a great opportunity to do that. But really, the funding is the key.
So then what would you suggest people in this room, people in Colorado, do to try to be successful to educate legislators about the $1 spent and the $7 return on investment, and kids are important? And every single individual who's trying to solicit their interest is going to try to get your interest. What can we do to be successful?
You're preaching to the choir to that group.
No.
You're preaching to the choir. Those people already know that. You've got to get Joe Schmo out there in the public to vote for a tax increase or some type of financial. What does Colorado come to? We're going to do gambling to support education. That's what we've come to. Because we can't pass education issues. We try. We put them on the ballot. They get voted down.
Casey has
We did it right here. We did it right here in our own county.
Casey has some ideas around different kinds of taxes. Go see her tomorrow. She's a thinker.
But it's new money.
She's got an idea for new money.
We're ratcheting down. That's what is the directive from the state of Colorado, is to ratchet down the amount of money. So every legislator is going to tell you, oh, I support that, Mom, apple pie, and you know, we're not going to use Chevrolet because they're not a sponsor today. So, but the point is how do we get there? You know, and that's what we've got to do. I think we all get it. I mean, at Grand County, I'm very proud of Grand County. We put money into Grand Beginnings. We funnel money everywhere we can. We've consolidated our juvenile services department. We're doing great jobs there. We're doing things. This group, the people in Grand County do an outstanding job, but still we're talking, I keep saying it, more money.
All right, well, I think this is a great opportunity for us to go into our next activity, which Karen is going to direct, and you'll have time to talk about these on a more specific county level